Well, hello, good morning, everyone. My name is Dr. Stormy Monks, and I'd like to welcome you to today's Grand Rounds presentation hosted by the Southwest Center for Pediatric Environmental Health. The Southwest Center for Pediatric Environmental Health is one of 10 PACEUs in the United States. These are Pediatric Environmental Health Specialty Units. The purpose of the PACEU program is to serve as a leading national source of medical information and consultative advice on environmental conditions that impact human health and development. To serve as part of our mission, we offer this Grand Round series once a month. We're grateful that you've joined us today as we hear Dr. Mendez speak about water reuse. But before moving forward, I just want to make sure that we have some housekeeping items discussed. So you will not be able to share your video, nor will you be able to unmute yourself. However, if you have any questions or comments, please feel free to put them in the chat, and we'll be monitoring that, and we can go ahead and give you responses, or at the end, we can read those off to Dr. Mendez and let her respond as well. In addition, we need to acknowledge our funders. So we partner with the US EPA, Environmental Protection Agency, as well as the CDC, the Centers for Disease Control and Prevention. And within the CDC, it's the Agency for Toxic Substances and Disease Registry that we work with, and as well as the Public Health Institute. Without the work of these three organizations, the PACEU would not exist. We want to make sure that you all are well aware of your ability to receive continuing education credits. This is the QR code that you would need to scan to receive those credits. And you would need to know that your activity check-in code is 4419. As you see right here, 4419 is your activity code. Don't worry if you aren't able to grab the QR code in time. We'll put this information in the chat for you as well. We're also offering credit hours for nursing. This is the disclosure for the continuing nursing education credits. We want to let you know that our next Grand Rounds presentation will be held on Thursday, October 16th at 11 a.m. Mountain Time. We will hear from Dr. Aguilera on the impact of air pollution exposure during pregnancy on maternal and neonatal health. If you have signed up for our Grand Round series in the past and are not yet receiving the monthly invites, it means that you do have to go back to the QR code and check all the boxes so we can register for you for the next portion of classes. This resets every year or so, and so we do ask that you use that QR code. Make sure that you're scheduled for the future sessions. I want to also let you know that we do quite a bit of different trainings. Two trainings that we're focusing on right now are pesticide use, as well as childhood cancer and environmental exposures. If you're interested in receiving curriculum on these two areas and receiving training, please feel free to email us and we'll get back to you as soon as we can. We will provide our email in the chat function as well. So without further ado, I am pleased to be joined today by Dr. Karla Mendez. So Dr. Mendez is an assistant professor at UT Health Houston School of Public Health. Dr. Mendez earned her Bachelor's of Science degree in biology at the University of Texas at El Paso. She has a Master's of Public Health with a focus in epidemiology and a PhD in environmental disease prevention. from UT Houston School of Public Health. Dr. Mendez has experience in conducting quantitative microbial risk assessments to address human health risk associated with different wastewater treatment technologies and water reuse implementation. Specifically, her work is the first to develop a human health risk framework to evaluate the impacts of different water reuse treatments and practices that incorporates a community vulnerability assessment. So we're very excited to have Dr. Mendez here today and to learn more about water reuse and the benefits and risks to our community. Thank you, Dr. Mendez, for joining us, and we'll go ahead and let you go ahead and start your session.
Thank you. All right, so I'm going to share my screen. All right, well, good morning, everyone. Again, thank you for having me. I'm Karla Mendez. I'm assistant professor at UT Health Houston School of Public Health here in the El Paso campus. So I'm excited today to share with you about the benefits and risks that water reuse processes have in the community. So we know that public health is a field that encompasses a wide range of health areas, whether that's environmental health, health policy, epidemiology, and so on. And one area that UT Health Houston is interested in is water, mainly here in El Paso, because this is a very unique location. El Paso Water is actually a global leader in water reuse. So I'm excited to share about water reuse with you. And to start this interesting topic, one of the overall factors that it's really important to emphasize is that all water is recycled. We know that. In the water cycle, we know that water, evaporates into the atmosphere, it condenses and then falls back into the ground and to replenish our waterways. So all water is recycled, every drop is reused in some way. And I don't think we think about that when we talk about drinking water utilities, how water is treated, how it is provided to our homes, and where that water came from in the first place. So if we do a side-by-side comparison between the water cycle and to what a community may do if they reuse wastewater, then it is really important to think of this as a way that a water utility plant is just simply speeding up the process. So what we're talking about here is intentionally taking wastewater and treating it to such high standards that it can be directly provided to the consumer at the tap as a drinking water source. And during this process, before we can implement a water reuse practice, we have to keep in mind that, of course, there are contaminants in our wastewater, right? Contaminants that we need to make sure to eliminate or reduce its concentration to safe levels. And this is what we do with wastewater-based epidemiology. We're measuring a pathogen's level in wastewater. And this has been done or been used to study everything from, polio to COVID-19, millions of human pathogenic viral particles are shed from infected individuals and introduced into the wastewater, subsequently causing waterborne diseases. And these viruses can be transmitted from wastewater to human beings via, direct contact and or ingestion or inhalation of aerosols. So we have to make sure that our advanced wastewater treatment technologies are able to remove pathogens from wastewater to prevent serious health risks and prevent outbreaks. Specifically pathogenic viruses, since they are more stable in the environment and more resistant to current wastewater treatment methods. So what can these pathogens tell us? Well, when we take wastewater samples, it is providing us with information of thousands to millions of people, which means that this data is non-identifiable. And this data of pathogens measurements is providing us with a snapshot of the overall health of a community based on what is being excreted. We monitor presence of infection within a community, and we can track trends in infection within a community. We can then use that data for public health action in response to different diseases, such as, a risk reduction response or, targeted education campaigns to raise awareness, for example. So we track a variety of data and put this information together to understand the local disease situations and decide how to best respond. The data is useful for action, but there's still much to learn. There are a number of drivers affecting the emergence and reemergence of infectious diseases. So once we have measured, our wastewater and detect or identify the pathogens present in our wastewater, one of the ways that we can assess the quality of the water and identify, best management practices to keep any health risk at bay is through the process of risk analysis. So the overall process involves three components. One is risk assessment, and I'll go into more detail in a little bit. Then it is followed by risk management, which takes, of course, the information learned from a risk assessment and then applies different types of values, maybe a cost benefit analysis to identify best practices. Risk management can then feed into the risk communication, and that is really a multi-directional dialogue within communities to hear their feedback and also their concerns, defer input on that water treatment innovation and on better ways to implement water reuse practices in their community. And then hopefully foster public health expectancy in terms of water reuse implementation. So these are the four basic components of a risk assessment. And in this case, the specific subfield is called quantitative microbial risk assessment, or QMRA for short. And why am I talking about QMRA? Well, we do this to evaluate water reuse technologies and identify our pathogens of concern, identify if we need additional barriers in our treatment technologies, et cetera. All of this is to protect our community that is receiving, this water coming out of the treatment plant. So going back to this QMRA, the four components of this include the hazard identification, exposure assessment, dose response assessment, and risk characterization. So it is a really an iterative process, right? Where information learned from one area can then inform another one. Oftentimes, these are paper studies. So the person who may be evaluating, the occurrence of hazards in the environment are providing that information to those who do risk assessment. And then they evaluate that type of output to come up with an estimated chance of someone becoming infected or ill from their environment. In this case, from drinking this water coming out from the treatment plant. And one of the important ways that this process can be applied is looking at the water treatment trains. So here is a simplified schematic of the water recycling process, starting with, of course, raw sewage or wastewater and how that water is treated. And this is just basic steps that any wastewater utility in the United States would follow. And if you look at the latter, what it says right here, filtration and disinfection, especially in the filtration section, this is where a lot of different barriers go into play in the water treatment process. When we're talking about a water reuse facility, we're going to add other layers of treatment so that water coming out from the recycling plant meets and most likely exceeds EPA's drinking water standards. What risk assessments can do, seen here in the red arrows, is that it can take water samples at different points of treatment and then apply this QMRA method that I'm going to be describing in a little bit more detail to come up with what are the chances that someone will become ill if they drink water that left the water plant at that particular point. So again, QMRA can be used to assess water after it has been treated. It can be used to evaluate a testing strategy to make sure that we have a robust and rigorous testing. And then it can also be used as a monitoring tool to make sure that the water is consistently of high quality as it goes through a distribution system after it leaves a water reclamation facility. And one thing before I go into detail with the QMRA, one thing that I want to emphasize with any risk assessment is that, of course, if there is no exposure, there's no risk. If there's any exposure, there's going to be some level of risk. And we know that, we don't live in a sterile environment, right? We all know that our tap water is not sterile. We do know that it is going to meet EPA standards. Water reuse treatment can even exceed national water quality standards. We also know, though, that water treatment is imperfect and there can be, many failures. It can be human error. It can be, due to natural events such as a hurricane, a flooding, extreme storms. We know that there had been documented outbreaks in the United States associated with drinking water that was already meeting EPA standards. And oftentimes it's due to a combination of events. Some of you may be familiar with the largest outbreak in the United States in Milwaukee back in 1993. This is a cryptosporidiosis outbreak where, people die from this outbreak. Most were elderly or HIV positive patients, so their immune systems were compromised, and they were just simply drinking the tap water that was already meeting current standards. So we know that tap water is not sterile. Perfectly safe water contains millions of non-pathogenic microbes in every glassful, but we want to provide as much protection as we can for our vulnerable subpopulations. And this is where the medical community and also the healthcare professionals come in. Several years ago, there was a colloquium by the American Academy of Microbiology, where they talked about these normal life stages and before, and I guess still currently, when we think about drinking water regulations, again, is to protect the most vulnerable, but also the general population. So, vulnerable population, we know it can include pregnant women, the elderly, children, for example. And what we've realized, obviously, is that these are just normal life stages, right? People are living longer than ever before. People are surviving transplants. People are surviving cancer. Many of us will experience pregnancy. We've all been children at some point, right? So why are we treating these as special cases? These are just normal life stages. And the question that this colloquium was trying to evaluate is, should the medical community and healthcare professionals be advising those patients to not drink tap water, since we know that there are outbreaks associated with tap water that meets current standards? And of course, the water utilities, they want to make sure that their community feels safe with their water. But I think that the key take-home message was that perhaps, of course, the medical community and healthcare professionals could be advising their patients based on the specific health status of that patient, right? As well as the watershed of the community. But I wanted to mention this because it's really important for the medical community and healthcare professionals to be involved and become engaged in water reuse practices and water quality. So, okay, going back to the 4 steps of the risk assessment process, starting with the hazard identification. When we talk about microbial risk assessment, typically these risk assessments were conducted because we know that there is an agent that is a hazard due to water. With unknown chemicals, back in the 70s, risk assessments like this were done primarily to find out if, chemical X could cause adverse health effects. We typically know which ones are causing adverse health effects because of outbreaks and because of the clinical symptoms. But a risk assessment will review the published literature and look for any connections. So we can ask, for example, are there certain subpopulations that are more susceptible? Well, then we look at epidemiologic studies. We evaluate the results of outbreak investigations as well. We explain the entire realm of health consequences. So we evaluate all of these factors during our hazard identification step. The next component is the dose response assessment, and it evaluates the relationship between the person and the hazard. And in the world of QMRA, we have a mathematician, civil engineer from the 80s. His name is Chuck Haas, who published extensively on dose response related to waterborne pathogens. And there are mathematical models that they identified that best represents the microorganism host interaction. And it's everything based on the amount of the pathogen or the disease causing organism, the dose, the route of exposure. It also addresses infectivity. So it's really important to have adequate data. For many of the pathogens, we don't have a lot of human related data, But there have been numerous human dose response studies published back in the 60s. There's more animal studies for chemicals, so we're still lacking in data for microorganisms. But we use these models as a template to then feed in other pieces of information related to virulence and related to the exposure. So now, addressing exposure, this is the area that contributes the greatest amount of uncertainty and variability into the assessment. It's very difficult to identify exposure even during an outbreak investigation, but it involves everything from how well can that hazard survive in the environment? Is it susceptible to environmental stressors such as sunlight? Is it susceptible to treatment? What was the amount in the water source? So many of these agents that I'm referring to are also transmitted through food. So it can complicate things by trying to figure out the source of an infection or outbreak. What is the route? All of these factors influence exposure. So a lot of more research is needed to have better and more effective risk assessments. So when we look at this, when we can think, what drives risk? Well, it is the exposure assessment that again contributes the most uncertainty and variability into the risk assessment. But a component that is not traditionally even part of this process are human behaviors. So now we can think, what drives exposure? Well, it's going to be driven by human behaviors. But what's going to influence behaviors is, there are decisions, and decisions are influenced by perception. This is where it's important for people to understand true health risks, coming from their environment. And then, what are the best ways that we can reduce that risk, right? Since it is such a complicated issue involving so many factors. So now, think about some of the public health issues. Again, we need to think about what is truly driving risk, which is human behaviors and perception and exposure. And then what are the best ways that we can reduce risk, since again, it involves many factors. And I want to talk about, these quantitative risk outputs, how they look like. What does the EPA use, for example? So, QMRA, even though, it's a lot of messy information where you can create assumptions, and we are uncertain about what we input, we do come out with a quantitative value. And it looks something like this. And now this is the risk characterization step of a risk assessment. So the last step, it will be something like 1 in 1,000, 1 in 10, 1 in 10,000. What this means, after all of those factors are put into the QMRA, four-step process, is that, for example, out of every 1,000 exposures, we can expect one of those to result in an infection. That's how it will be applied by the EPA as well. And so with those response models, we are addressing infection and not illness. Illness would incorporate other factors such as morbidity ranges. And I have the 1 in a million in red in here because for microbial risk and drinking water that we're talking about today, this is a benchmark that the EPA uses for daily risks of infection. So any drinking water, leaving a water utility, going through the pipes to your tap, for our community, the daily risk recommendation should be that no more than 1 will result in infection out of a million. So maybe it's not absolute, but it can help us identify what's driving risk, and it can also help us identify other layers of treatment that should be implemented to keep the risk lower than the risk recommendation. And as I mentioned, the overall scheme of this is to identify hazard levels, and then we can translate those levels into health risk. This will lead to the identification of different types of water treatment, how effective they are, how much they are able to decrease those hazardous levels, and then we translate that into health risk reduction values. And then this will inform the risk-based standards. So when you think about drinking water, we have those numerical values, the quantitative value of the actual hazard that's in the water, and they will also be translated into those ratios that I just showed you in the previous slide. So exposure is what's driving risk. So then what's driving exposure? We said it's the people. It's how we are exposed. It's all the different ways the hazard can be transmitted throughout the environment, through the soil, the air, the water, the food. And this complicates, of course, the QMRA process and in trying to identify best management practices to reduce risks. So let's think again about that risk perception, because risk perception is what's going to drive the decisions and the choices and then the behaviors of our community. Something that is voluntary is likely to be more accepted. And something that we do at UT Health Houston School of Public Health is that we work as, consultants. We can work as consultants for different communities in the United States where they are thinking about implementing water reuse practices. And sometimes they've already been having meetings for years without even involving the community. And we always emphasize that the community needs to be involved at the outset. They need to know what's going on, what is being considered in their community and how this may impact them. And they should also be able to provide their expertise and their perspective on this issue. So what we've realized is that the communities where people feel like they do have a choice and an input, the more likely they are to accept water reuse practices. If there is any chance, of an environmental injustice in terms of, where is the plant going to be built, for example, those conversations need to begin at the outset and including the community as well. Knowledge, the more people understand the process of water reuse, the more likely they are to accept it. When we relate the water reuse process with the water cycle, like I did in the beginning of this presentation, in saying that, in essence, all of the water that we're drinking has been recycled through our environment in some form or fashion, that this is a natural process, right? Then it is more likely to be accepted as opposed to creating something that sounds scary, such as human-made technology that can create human-made risks. And then the individual human health that can be an issue, and where the medical community can have a role here is by helping explain this process of where we get our water from, right? If individuals feel that water reuse produces water that is just as safe as their current drinking water leaving the tap, the more likely to be accepting of that. One area that is, of course, not helpful is comparing health risks to something that is totally unrelated, right? So if you remember, in that slide where I had, 1 in 10,000 or 1 in over 100, to say something like, oh, you're more likely to get struck by lightning than getting sick from your drinking water that was processed through a water reuse facility, that is not effective and can almost be insulting. It is really not appropriate to compare risk in that fashion. And then, thinking again about the medical community, I cannot emphasize enough this relatively new terminology of normal life stages. Again, most of our population is vulnerable in some way. So it's important to think about that when we think about drinking water, and when we think about the importance of water for health and the advice of physicians and healthcare professionals to their patients. There's a lot of questions, especially from pregnant women, asking, hey, should I be buying bottled water instead? There's many different point of use filtration devices that are found in the market. And think those customers who live in rural communities, right, where a water body might be found to farm runoff, and that's where it's deemed to be perhaps more useful to be using, point of use filtrations. Now, with the hazard factors, when we think about emerging pathogens and what's presented in the media, this can cause some confusion. If you all remember at the beginning of the COVID-19 pandemic, there was a lot of hoarding bottled water, and that was really because for a couple of reasons, right? One, if people feel like they can't go out, then they tend up to stock up on bottled water and other commodities. There was also a concern that maybe this virus could be waterborne. So there was a lot of media output in back in 2020, right, explained that this was not a waterborne agent. One of the potential confusing factors that I think caused that perception is that we can find SARS-CoV-2 in wastewater. So even though the World Health Organization and CDC and other researchers said, that there's no documentation that was a waterborne agent, typically, when something can be passed in the feces of wastewater, it does typically have that fecal oral route of transmission. But, technology and tools that have been useful is the evaluation of wastewater for the virus, since we know that, someone becomes infected with SARS-CoV-2, they're more likely to excrete in their feces 3 to 4 days post-infections. But we know it cannot be transmitted through the water. Wastewater surveillance, like I talked in the beginning of the presentation, also monitors new variants of SARS-CoV-2 to track surges and also identify, hotspots in communities. Also, following COVID-19 pandemic, wastewater monitoring has been used to track seasonal influenza viruses, including types A, types B, monkeypox, as well as to successfully detect it and track its spread in affected areas, etc. So there's been, including here in El Paso, obviously, wastewater epidemiology getting conducted to help predict should there be a looming outbreak based on what we are seeing in the wastewater. So many communities are doing that. El Paso Water is currently monitoring for at least 10 viruses, including norovirus, monkeypox, polio, dengue, Zika, West Nile, and SARS-CoV-2 variants, etc. And then also what's driving risk is also those environmental events that we're seeing more constantly, one being pandemics, or if there's some severe storms like flooding, for example, the destructive flooding that took place in July of this year in the Hill Country region in Texas. And also, we remember what happened back in 2021 in Texas with the winter storm, right? It happened to the potable water supply and the panic that ensued in the rest of Texas. It caused a lot of damage. So this is all going to impact our drinking water supplies and also the perception of risk. So what are some perception drivers about water reuse, right? When we're trying to implement a water reuse project, we want, of course, the community to support the water reuse, right? Because if we do not include the community or if most of our community is against a water reuse implementation, if the water treatment still decides to go for it, to implement the water reuse against the community is more likely it's not going to be using that tap water, right? So the treatment facilities are just going to be spending tons of money for something that the community is not even using, right? So it can go either way. There can be pros and cons. There might be some aspects that the community might like or might not like, but all of this will be different for each type of community, because if we know that each community is very different. So therefore it's important to evaluate their perceptions on water reuse. So when we include the community from the very beginning, some drivers that support water reuse may include, first, the environment. The community may want to ensure that water reuse designs are safe for the environment, right? Acceptance might be higher when protection of the environment is a clear benefit of the reuse. But also health is another important factor for the community. So people may have this belief that even the best technologies can remove all impurities and the pathogens from the water, so increasing their health risks. However, this might not even be the case. The more the public learns about how water reuse works, the more likely they are to support the water reuse projects. Information and knowledge play an important role in the shaping perception and in the nature of public participation. So any uncertainty or incompleteness of information the community may have, it may influence their perceptions on water reuse. And so there needs to be trust, right, in the community. Public perception comes down to how much people trust the government or local decision makers to disseminate information about the safety of their drinking water. And I remember El Paso Water did a community survey back in 2016. They were trying to talk about their new water reuse treatment facility that's actually, it started building this year and they're going to be finishing hopefully by late 2027. It's an advanced treatment technology that's going to be exceeding EPA's drinking water standards. So they did this community survey. El Paso Water has been really involved with the community. So back in 2016, they did this community survey. They asked them about water reuse, and they asked them who would they trust the most to disseminate this information about water reuse and drinking water. And most of our community here in El Paso selected healthcare professionals as the most reliable people to disseminate this information. So this is why it's important for physicians and the healthcare community and public health community to be involved in these talks of water reuse and be engaged with the water use practices so they can also pass on that information to their community so that the community can feel safe with their water. So to be more specific, there are some factors that foster water reuse. People tend to support water reuse for environmental stewardship. Water reuse projects can provide positive environmental impacts. It can provide, alternatives to existing water supplies and enhance water security and sustainability. So this contributes to the improvement of water quality, which in turn can increase the economic sustainability, right? People typically understand that if there's not available water sources, the community will be water strained or water stressed, and this can result in an economic issue. So the importation of water can be very expensive. So it's important to have a plan for diversifying water sources. Individuals also tend to support water reuse projects for the diversification of water resources, especially if these individuals already have some knowledge on water stress areas and water reuse practices, such as it can also, irrigate parks or golf courses, just to name a few. So the combination of these four factors will usually result in the acceptability of water reuse from the community. On the other hand, we can also have factors resulting in the opposition of water reuse. First and foremost, human health. Again, individuals have concerns on how water reuse will affect their health. For example, the term toilet to tap is used sometimes to describe water reuse practices. But the thought of drinking water that once ran through, the kitchen sink or the toilet, of course, is not appealing to individuals. So it may sound dirty and unhygienic, which in turn increases their concern. Religious beliefs is the next factor compromising acceptability. Some people use water for religious purposes to, obtain ritual purity, if impurities such as urine or feces, can contaminate the water and can change its odor, its taste, or even the color, then this water cannot be used for religious purposes anymore. So this emphasizes the importance of getting the community's input and direction in these practices so that however water reuse is done in your community is culturally sensitive. So decision makers should incorporate local cultural values when it comes to water reuse. Again, lack of trust. Some people don't trust, the government or local decision makers to make sure their drinking water is safe. Cost is another factor. The community might think that there are other alternatives that are more economically or more beneficial, such as the importation of water, but this is not always true. The costs of water reuse, vary greatly from place to place depending on the location, but generally reuse is less expensive and less ecologically damaging than most other water supply projects. And lastly, intended use of water, meaning, how the reused water is going to be used. Is it going to be used for irrigating golf courses or parks? Is it going to be used to replenish the groundwater source that can be used for drinking water? You know, when the degree of human contact is not minimal, so when it is not used for non-potable purposes, people tend to oppose water reuse. So it is important, again, to know your community and determine what factors works best for them to increase acceptability. Okay, so we evaluate our specific watershed in our community. It's very important to evaluate our watershed, you know, to know what type of pathogens are in our wastewater. We measure the levels or concentration of these pathogens through wastewater-based epidemiology, like I mentioned previously. This data will give us a snapshot again of our community's health and also help water utilities to implement the best water reuse treatment technologies or mitigation measures to eliminate or reduce levels of these pathogens. We can conduct a risk assessment to evaluate the risk of infection after each water treatment barrier to ensure public health. We can then use this risk assessment data, translate it to human health, and communicate this with the public and also with our stakeholders. And to do this, we need to work with the public health departments and create also partnerships to understand their needs and concerns. Every community, again, is different and will have different characteristics, different behaviors, perceptions, and also concerns. So these aggregated data can be shared and communicated to the public, to the health officials, even with, you know, policymakers through a variety of mechanisms, you know, including a public facing data dashboard, or maybe weekly summarized data briefs or restricted access data dashboards for health departments, for example. And of course, it's also important to continue collaborations with key stakeholders, you know, such as hospitals, the health departments, business owners, etc. These stakeholders can help in to interpret the data and inform the community health interventions, to also raise public health awareness of disease transmission within communities and share water use practices information regarding you know, meeting high water standards. And I think, again, what's really important for all of us, for any community, is to know their specific watershed. Where do we get our water from? Is it surface water, like a river? Is it groundwater? You know, Paso, we have both sources, right? But it depends on the time of the year, and that implicates, you know, how treatment is implemented. And it also can be a predictive tool of what could be a health hazard to a community. So I think that's important for everyone to know, including our medical community and our healthcare professionals, what our community's water source is and what are the vulnerability factors in our specific environment that can compromise that water source. So we can then connect water treatment with water quality and understand what those health risk benchmarks are and recognize the risk reductions that's already in place. That, you know, this is very important for water utilities to keep following, as this can help us better inform our community about, you know, water risks, and for physicians and healthcare professionals to better inform their patients. Once again, we need to incorporate our community and key stakeholders in water reuse practices, you know, to share our community's projects on dealing with water quality, the waterborne diseases, and to listen to their concerns. That way we can find innovative solutions to prepare for any outbreak or disaster that will affect our water quality. We need to try to implement human health risk assessment framework to identify pathogen threshold concentration for wastewater monitoring. This will allow us to take the data generated from the utility monitoring and translate it to human health that will be used to inform risk communication. So with this, we can say how many infections were prevented because the utility implemented those technologies or those mitigation measures. And with that, I end my presentation. So thank you so much. I have my email right there in case you have any further questions after these presentations. And if you do have any questions right now, I'm more than happy to answer them.
Thank you so much, Dr. Mendez. That was a very interesting talk. If anyone has any comments or questions, please put them in the chat and we will go ahead and provide those to Dr. Mendez. I was going to ask you, where can we get more information on the human health risk assessment process?
Well, within the UT Health Houston, our school, we do plenty of research of QMRA and with chemicals and even pathogens. So if you have more information, of course, you can also email us, but also the EPA are doing the same processes. We use their benchmark. So EPA has really good resources on how that process goes with water as well and with other environmental factors such as soil or even food. The EPA also has many resources. So if you have any questions, please either email me, but also the EPA, you can search for that information as well.
Okay, thank you. Any other questions?
So
I have a question from.
yes.
Oh, sorry. Go ahead.
No, sorry, I was gonna read the question. So what role do you see water reuse playing in addressing future water scarcity challenges? Well, right now, water reuse is really becoming a topic not only in this community, because of course El Paso Water is a global leader in water reuse, but a lot of communities that we're seeing in the United States are becoming more water scarce, water stressed, and they're trying to look for alternative ways, right? They may have a desalination water plant. They might look at other alternatives to implement. What they don't usually look at is water reuse, because again, they don't know a lot about water reuse, but again, also their communities, their communities are so against the water reuse practices because of all the misinformation that's out there, or the terms that they use. For example, the toilet to tap that they use to incorporate these water reuse innovations. But nowadays, water reuse is becoming a more popular project for many of our communities in the United States. They're not that advanced like El Paso Water, because we've been using water reuse for so many years. So we're a little bit more advanced. So communities from other United States, or even from across the country, are actually coming here to El Paso to learn about our water reuse practices and also our technologies, because they are trying to implement them into their own communities. So it's becoming more popular. They don't know they need help on how to implement it and how to go along with their communities. So it's becoming more popular. And I foresee that in the future, we're going to be having all over the United States more and more water reuse technologies and water plants.
Wonderful. Thank you. Okay, we have another question. Would you like me to read it, or?
Yes, please.
Okay. Not sure if you have info on this. How many people are familiar with the water treatment process? My father used to work at the water treatment plant, and the process is quite interesting. I would imagine people are confidently making decisions without understanding the journey that water takes getting into our homes.
Right. So I don't necessarily have like a specific, statistic of how many people are familiar with it. I do know it here in El Paso because I've been researching here in El Paso. I know that El Paso Water has been incorporating the community for decades, for over 2 decades at least. So of course, the El Paso communities know more information or have more knowledge about how the water reuse process goes. But again, outside El Paso, at least, the communities, they don't have a lot of knowledge, because the water treatment technologies, they just decide to implement them without even talking to their community. Of course, because of that, the community is going to be so upset about it. They're going to be saying, "Oh, it's affecting my health. I'm not gonna be drinking the tap water," because they don't know the process of it. So I don't necessarily know. I would assume that not many people know about how water reuse goes, again, because in the past they've used a toilet to tap term, and because of that it's become nowadays, still nowadays, a really misunderstood process. So I can say that not a lot of people know about it. In El Paso they do, but not outside of here.
Wow, thank you. Thank you. Excellent question. Thank you for your presentation. In your opinion, what factors contribute the most to the variability in the microbial risk assessments?
Right. So, like I mentioned, there's 4 steps in the QMRA, right? And I mentioned that the exposure assessment step contributes to the most uncertainty and the most variability, because during that process, we're trying to extract, exposure factors or different factors to incorporate into our mathematical model. And we know that these pathogens, the people can get infected with these pathogens from different sources, from the water, from the food. Some of these pathogens have the same route of exposure. So it's difficult for us to actually identify how specifically this person or this community was infected with this pathogen. Was it the water? Was it the food? Was it something else? So that's why we say that there's a lot of variability in the exposure assessment. We don't know 100% how they became infected, but we have to make assumptions, and we have to, again, find in the literature review for more specific data. But 100%, we are not sure how these people got infected or will be getting infected, since pathogens have many routes of exposure.
Thank you. I know this is kind of going off topic, but I've read and I've heard articles and seen presentations where people are talking about, you know, the water reuse programs and how they produce safer water that are, national standard or higher, and that they're oftentimes better than getting bottled water. Um, and so I think that that's a great something that we need to get out into the public.
Yeah.
And I love, everyone's walking around now with their Stanleys or their their other things. So that's wonderful. But yeah, just the thought that, your tap water is safer than
Yes.
bottled water. Yeah.
Most of the bottled water, what companies do is just take the same tap water and they just add maybe flavor in it or some additional minerals, but it's the same tap water. So we can say that tap water is safe. You don't have to be buying bottled water because it's gonna be at the end of the day the same, just with a little bit of more flavor or a little bit of this and that. But it's the same at the end of the day. The water reuse process has been evaluated, has been for so many years. We have right now very advanced technology that can transport this water. It can exceed EPA's drinking water standards. So we can say that tap water is safe. El Paso is very safe tap water. So yeah, it's very interesting, the process of it. I encourage everyone to just go to, if you live here in El Paso, to just go to the water reuse plants. They will be happy to give you a tour, and you'll learn about all the process that they go through, and they will actually give you, the water, the tap water, right from the treatment plant to drink it. And it is very safe. So I encourage you to go there and have a tour. It's really interesting.
Thank you. Yeah, that's a great idea. Okay. Well, if there's no further questions right now, everyone, please know that you can email Dr. Mendez. She has provided her email right here. If there's anything that we can provide you, our email is listed in the chat. Please remember that we want you to get your continuing educational credits. And so you can use any of these links up here on the chat to make sure that you receive those. And remember that the presentation code is 4419, 4419. Also, we provide this Grand Round series once a month on the third Thursday of the month. And so if you're interested in next month's presentation, we would be happy to have you join us. You can go ahead and if you need information on how to register for that, please feel free to email us at the SWCPEH at Texas Tech University Health Sciences Center at ttuhsc.edu. I know that was fast, but it's there in the chat if you want to take a look at it. So again, we want to thank you, Dr. Mendez, for joining us and for teaching us about water reuse today and its effect on our community. And we thank you for your partnership and all the work that you're doing here in our community and how you all are leading our nation into clean water standards. So thank you so much. We hope that everyone has a wonderful day.
Thank you, everyone.
Bye-bye.